Welcome to the Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have a special guest, Dan Raio, and he is the CEO of House.md. Dan, welcome to the program.
Thanks for having me, Tom.
Awesome. So House.md, you can find them at hmd.healthcare. Great organization. I wanted to bring you onto the program because you focus in on the workplace and providing healthcare in the workplace, and obviously the workplace is quite complicated these days because of the pandemic, because it extends from the physical brick and mortar of the workplace and into the home where a lot of people are working remotely. So tell us a little bit about the organization itself, its history.
Sure. Thanks for the question, Tom. So look, I actually like the way that you said that, right? Because especially in today's mid-pandemic world, I would say, I'd love to say post-pandemic world, but mid-pandemic world, we do live right now, and we've learned a lot of the last 2 years as a society in general, that there is this kind of workplace, work from home process that companies are learning about, right? House.md, on its foundation, was created to provide convenient quality services and care to people in their home, in their office, on vacation, wherever they may be, right? In a convenient and quality fashion. We kind of went more into the corporate health, brick and mortar corporate health sphere, especially during the advent of this pandemic. And what we found was a lot of companies, these large, Fortune 100, Fortune 500 companies, and below, even small mom and pop shops, were having to have this kind of hybrid workspace now, right? And so it actually brought us closer to the process of providing care through telehealth services, through in-person services at both the workplace and at home. So when you said that, it just kind of triggered that thought.
Yeah. So the service itself, to your point, just like any clinic for that matter, you have the services in the facility in and of itself, and then you provide virtual care to extend services into the home. And again, referring to some of the literature that I've read in our conversations, you talk ultimately about lowering the cost of healthcare. So these self-insured employers or employers themselves that have insurance elsewhere. Tell us why your service matters in the context of already providing health insurance to their employees.
Sure. So if really whether you're self-insured or insured in the normal manner, providing healthcare services at your workplace decreases your cost in many different ways. Think about employees that need to get evaluated. They have a sniffle or they have an issue. What we've found just over the course of time, even pre-pandemic, is people are utilizing urgent care as their primary care, for instance, right? And what that costs the workplace is time, sick time, right? As opposed to having services right there at your location that you can utilize, whether it's through virtual technologies, right? Enhanced telehealth services, or having a process there that gives people the immediate kind of option to see somebody right there at the workplace. So that's one way with which you reduce the overall cost of healthcare for an employer, right? Because now you have the access to care right there through technologies or through in-person services, depending on the size of the corporation. Look at Google, right? If you look at Google and Facebook and these big organizations, of course they have the ability, but they essentially run their own whole healthcare organizations on their campuses or at their locations in various areas. What we allow is a very cost-friendly way for companies to actually have a Google or Facebook healthcare for their company at their site on their location. Working with big realty groups, we're working and we're going to be looking at launching healthcare organizations in their buildings, coming soon, right? That would allow healthcare services for all the employers in the building itself. And in doing that, there's a way to make things right for the companies, make the healthcare organization whole and solid without having to join, a big conglomerate or rely on the government to provide those services for you. So there's a whole slew of different ways that can be done. Technology is the main key element in getting it there.
Yeah, and that's what I love about today's environment. We spoke offline about some of our past experiences with healthcare and the good, bad, and the ugly to some degree. But the leveraging of technology. Technology isn't necessarily the answer. It's certainly the underlying fabric that facilitates the delivery of care in new ways that weren't considered 10, 15, 20 years ago. And ultimately allows that, to your points, it allows an organization to operate a bit more efficiently and get greater productivity. But most importantly, the employee themselves can get better access to care, because sometimes employees, I'm sure you would agree, I know I'm one of them, frankly, you kind of put off. Right. I just went to the dentist yesterday, actually, and 2 weeks ago I had a root canal. It was a lovely experience. So the point there being is, they asked me when the last time I went to the dentist, and I told them it was a couple years ago, and I said, listen, at the end of the day, it didn't hurt, so I didn't come. Right.
Right.
So, healthcare is a lot like that, right? It's so reactive sometimes, but the accessibility to healthcare and what the services House.md is providing allows a patient to be more proactive in that it's convenient and therefore accessible. And then therefore you would think the dominoes would be a healthier employee. Your thoughts?
So I agree. I think there's also a lot of, if there's any, folks that own companies out there, CEOs, things like that, listening to this broadcast here, I think the one thing that I hear when I talk to these folks is, we've tried this, we've tried that, right? Engagement is important, right? And a lot of my competitors, and I think a lot of them are great, right? I'm not downplaying any of that, but I think the focus is not on the problem. Okay. The problem is not, you could have easy, convenient access, right? But if you aren't engaging the person to actually believe and trust in the care that they're being provided, they're not going to use it. Look, studies show that patients across our nation feel disenfranchised. There's a lack of trust in the healthcare industry. I mean, there's a lack of trust all over the place. We're not going to get into that today.
No,
but
please.
There's a lack of trust, right? It includes the whole spectrum, but we're talking about healthcare today. There is a lack of trust, and there's a wide gap in understanding between the doctors and their patients, right? And some of that is through the corporatization of healthcare in many respects, right? You've seen over the last 10 to 15 years, there's been kind of like a hurdling of doctors and things like that used to have their own practice that are now, moving to hospital systems and things like that. And I think that's fine. It gave them fair shelter, and they weren't able to, operate their business side of it the proper way. And they made the right choice in many respects. That I'm not knocking any of that. What I'm saying is that this disenfranchisement actually affects the delivery of care and the ability for patients, doctors, PAs, nurse practitioners, nurses to actually do something that produces true preventative care, true preventative medicine, like you with your tooth, right? Mm-hmm. It doesn't hurt right now, right? But if you don't have it evaluated and assessed, a couple of months down the line, that could turn into a much bigger issue. You could now have an infection in the bone of your jaw, right? And it could lead to a cataclysm of events that causes more healthcare issues for you in the future, just because you didn't take care of your tooth, right? I'm not knocking you.
Okay. No, I'm with you. Go for it.
So it's not only about time, right? None of us have time, especially I live on Long Island. So I don't know if you know anything about that, but
I do. I'm from Jersey.
On Long Island. Okay. So,
Yes.
Most of the times in a regular middle class family household, or even upper middle class, both parents have to work, right? You want to grow your family and have kids and do that stuff, but time is of the essence. And that's why convenience is always a key factor. That's why Amazon flourished. You're right. Years ago, when it was first started, there was it was kind of like, this is silly. Who's going to do that? Right now, I mean, I get everything through Amazon at this point. Right. So the thing is, convenience is key, but also it could be as convenient as you want, but The actual quality's got to be there, the belief that you're going to be providing the services, the care in the right way. And again, you could talk to many of our corporate leadership to the highest levels, and they will say, even though a small kind of sample size, because we've only been in existence for about 5 or 6 years and only working with these folks for about 2.5 years, but they will say without a doubt that we provide care that people believe in and would utilize. Other than that, wellness programs, all these different things. But if the focus is always on the bottom line of the budget, then you're not going to do the true thing, which is build the trust factor between both, and especially in a virtual environment, right? Yeah. Right. A virtual environment, if it's a quick one and done, I just want a Z-Pack. I'm doing air quotes. You can't see me. Look, I'm not knocking Z-Packs, but what I'm saying is it is not the preventative care. It is not what we think virtual care can do. We think it can do more. We know it can do more with what we've done.
Yeah, and interesting word, trust. And you mentioned earlier the issue of a cost focus versus a wellness focus and a quality of care focus. So it reminds me of Congress to some degree, where Congress says, hey, it's got to be budget neutral if we do something. At the end of the day, and when you step foot onto an employer's prem, I'm sure your focus is, to your point, knowing you and your organization, it is about establishing trust with those employees. It's really about the engagement model. And the more that you can engage, in my view, the better the trust relationship and the better the engagement. It isn't, oh, you spent too much money with us today, let's not do more, right? It's really about, how can I get you engaged? And then, therefore, how can I work with you on achieving greater degrees of wellness? And then that, at the end of the day, is a reduction of cost. But if you're going to start with the cost model up front, it's a problem in and of itself. It's an inhibitor to the transformation that we're all looking for. Your thoughts on that before I go to my next point?
Yeah, you're absolutely right. Let's go to the example that I gave. You asked the question, like, give me some examples, and I gave you one, right? I gave you the workplace, somebody's calling out sick or they're not feeling well, they want to go see their doctor or whatever, right? If you have that trust factor and that true engagement factor, that person, the first place they're going to go is, well, let me call House.md. They're right there. I trust them. I believe in them. Why am I going to go down the block to someplace? A lot of young people, especially, you could poll them yourselves, or you could look at the studies, don't have actual primary care doctors that they can call. And if they do, they're usually not available at a time where they need them, right? Because this conveyor belt mentality and things that have been created, we won't get into that, right? But so the thing is, if you focus just on that very simple process and building the trust and put all of your emphasis on that, then financially, if you're thinking about the business of medicine, you are going to do much better if you do that. Because now we are now the client, right? So that's where the business model is, right? We got to tell the client, right? So we got to tell them that we're going to reduce their cost of healthcare. If you don't do the first thing, which is provide the quality care, you won't give the benefit to your client. And every business wants to solve a problem. The good businesses want to actually solve the problem. The problem on their side, yes, they're crunching numbers. We provide that care. Those numbers, they're going to realize the reduction in cost to healthcare because their employees are actually going to use the service. It's crazy, but it's true, right? Yeah. So if your focus is there, you will do what it is that you need to do on the numbers side. And you're doing the right thing at the same time. What a great concept.
Yeah, I agree. If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley, and today we have with us Dan Rayo, and he is the CEO of House.md. You can go to hmd.healthcare to find out more about this great organization. So, Dan, let's come back a little closer to the specifics of House.md. We talked about working in the workplace. Is that your only focus of business? Is that your core sector, or do you expand elsewhere?
Yeah, so currently it is our core sector. We are beginning the process of pivoting back into what we were doing pre-pandemic on top of the corporate health process, where we provide healthcare services to folks that are either having major health issues, right? We're going to focus in on that first, that cannot receive the quality care that they require. So an example would be folks that have chronic disease like congestive heart failure or COPD. especially those that have kind of end stage situations where they can't really leave the home. Now, this would be your typical, people would call this, so you're a house call company. I, again, did air quotes because we're not a house call company in the sense of what people have experienced. And if there's regular patients listening, they know what I'm talking about. There is a big gap in care of people that can't actually receive services, that wind up getting readmitted to the hospital, for example, for something that they likely did not need to, right? It's the proverbial low-hanging fruit of medicine. And one way to do that is through innovative technology-based technology with the human condition. So, I mean, with the human element, with doctors and PAs and nurse practitioners and RNs, that actually can deploy services that feel and touch the person, that can deploy services that allow for telehealth integration, that allow for where we could deploy somebody that's certified, on an MA level to an extent, but allows to the utilization of the technology for the folks that wouldn't otherwise be able to do so. So that way, the good docs that are providing the services now have more of an enhanced telehealth situation, digital stethoscopes, digital audio. Anyway, I don't want to bore you with that, but
No. That, Dan, you are spot on. My audience knows that there's a number that I always talk about, and it's 8,745.
Okay.
And the point there being is that we can talk about the encounter all we want. That's where care is delivered, but health is achieved in the 8,745 hours you're not in front of the doctors. And I'll clarify that. Average Medicare patient, 5 chronic conditions, sees 9 different doctors in a given year. They only spend 15 hours in front of their doctor. The question is, what happens the other 8,745? That, to me, is how telehealth, virtual care, the virtual shift needs to take place. And how do we address that gap in care? Because that's, in my view, that's the gap in care. So to your point, the employee and building trust, it's not just building trust in how our parents saw healthcare, right? They went to the doctor and they came home, and they spent a lot of time not doing what the doctor told them to do. At least my father did. And so we talked about that.
Listen, most of us do, by the way.
Yes.
That nobody's a saint, right?
No, I agree. But the idea of using medical devices or wellness devices to monitor a patient in that gap helps you anticipate, project that an outcome, there's an unwelcome outcome coming, if you will, right? So thoughts on that? Is that where you're going? And, some people call that remote patient monitoring, but your employee is already home, but still needs to be monitored. Thoughts?
So my thoughts are you're exactly spot on, right? The only piece that and I wouldn't expect you to bring this part up, right? But you're spot on. That is a way that, as long as, first of all, if we do the first thing that we said and we build the trust, right?
Absolutely.
Now that patient trusts, it's not just some medical assistant or some technology associate coming. It's somebody that they trust, that the doctor on the other side now is utilizing that technology to help them. That is of the utmost importance. If you want to go on the financial side, what hospital systems and big organizations want, and which is rightly so, is to mitigate against them getting penalized for a readmission or things like that, right? And I'm not saying that these great organizations don't focus on the patient care. They do, right? I've worked with a lot of them, but that side of it also, the technology must be utilized, because if House.md goes and sees a patient that was recently discharged, right, with heart failure, then we need to be able to connect in some fashion with the hospital system that they came from, because people get hospitalized, right? You hear this from patients all the time. They're like, well, I was doing fine until I went to the hospital. And now I came home, I'm on all these meds, What they're failing to realize is, no, it was just a quick decline in your health status. The hospitalization is what saved your life. And now you got to deal with this after the fact. And because things are moving so fast and there's so many patients and things like that, there's maybe they don't fully understand the ramifications of what exactly happened. It doesn't mean that anything bad happened in the hospital to cause you. Most likely, well, not most likely, 110%, a chronic disease started literally from the day you're born to that point, right? It's not something that happened in a month or 2 months or even a year. It's of process. Now that's more on the medical side of just explaining what chronic disease is. But the bottom line is, think about that. If it took that long for this disease to actually cause this cataclysmic event to slow you down, and now you're already older, hopefully you're older at the time when this happened, then you must have the presumption that it's going to take a lot longer for you to recover, and also the realization that you may not even come back to baseline. And people starting to understand that and then say, okay, it is what it is. I can't change the past. And us communicating with the hospital institutions, with the patient and their families, that connection in home care. But you need both. You can't just have one, right? Because then we can't provide the care we want without the information from what happened. And they can't receive the care or trust in the care without understanding that we connect with their cardiologist. We connect with their that is a big lift. I get that, right?
That is a big lift. Yes.
It's a big lift, but it's not as big as you think, because it's a big problem that they have on the healthcare institutional side. They have that problem because they need to focus on their brick and mortar organization and institution. It's very hard for them to deploy a proper system for this. And our focus at House.md is that space. So we are the connection. And this is what I believe we will become as we continue moving forward. And we were before COVID. We will be the connection between the hospital institution and their patients. It's not about stealing patients. I'm doing air quotes.
That's right.
It's not about that. It's not about stealing patients. No. It's about solving the healthcare crisis in this country. And that means sharing patients in a proper way.
I am 100% with you. So, I was speaking at a conference a couple years ago, and I said, listen, we often find health systems competing for the same patient. Sure. And my argument is that we have a growing population, we have an aging population, sicker population, developing, to your point, more and more chronic conditions as they get older, and they're living longer. The other half of the problem outside of the 8,745-hour gap is we have less doctors and nurses available to treat that older, age, or sicker population. So it's not about competition. And we talk about, in the context of remote patient monitoring, you always hear, alert, I got alert fatigue, I can't do that. What House.md is bringing to the table is, in my view, is a collaboration and a partnership between the employer and their employees, and between the health system and the employees. And you're helping offload what they believe is a problem in and of itself. I don't have the resources, less doctors and nurses. I got more and more patients coming in, right? And I just can't handle the load of now monitoring them offline, if you will, right? Sure. Your team is kind of the glue to all that, relative to the clinical services you bring to the table, relative to the technology you bring to the table, and ultimately helping close the gaps and addressing the larger problem in healthcare. That's thoughts?
Right. Yes, I agree completely. And it's really, you obviously do this for a living, so you understand in terms of talking to healthcare organizations, but you actually read that perfectly. It is exactly what we do. It's what we do in all facets, by the way. So, for example, I talk about, I'm not bastardizing urgent care, for example, right? The beauty of it is what we should be doing and what we are doing, what House.md is doing in corporate health or in personal health, is finding the right times to refer those patients to the right places. Urgent care, for example, great companies, and again, I'm not saying any crazy strategic partnership or anything, but if you create that connection and that strategic partnership with an urgent care, then when somebody isn't feeling well, but you do need that extra level of care, right? And you're doing it virtually. Well, you need some place to send them. Do you send them to an ER, which costs the healthcare system a lot of money? Or do you send them to a place like an urgent care that they can get an x-ray and they can get the things that you need? Do you do the same thing if somebody's in the home, right? So those partnerships, that glue that you're talking about, is, I think, the space in healthcare that we're focused on. It's an open space. I welcome any other organization to do it as well, because there's more than enough problems to solve.
We only have a few minutes left here. So I often say that, urgent care has its place. Yeah. It'll always be there. Primary care has its place. It'll always be there. But the new delivery of care model is continuous care.
Correct.
It's about the end-to-end experience. And, just because you're not inside the brick and mortar doesn't mean you don't have access, and doesn't mean you don't have assistance. And to the provider, it doesn't mean that you don't have help as well. So it's that continuous care model that really is the new delivery of care model.
Let me ask you a question. What do you think that continuous care actually means? What does that mean to you?
To me, it means that patient has continuous access to care, but ultimately I can have a medical device, whether a wellness device or something that is actually in a remote patient monitoring context. That data is flowing in real time to a place that you are monitored, and then you have some intelligence as to should we intervene here? Right? I just took my blood pressure. Is that a good number or bad number? I don't know. Right? But I know somebody's it's not the doctor, but it's the doctor's partner, the collaborator, that's saying, hey, that's a good number. Keep going. Right?
That's the first input. Okay.
Right. Exactly.
And that is true. Right? Without that device, without that technology, you can't get the information there. The other side of it is where it's connecting to. And so when I think of continuity of care, right, I think of exactly what you said, but I also think of who is the person that's interpreting that data and understanding that data, and then giving the right advice to the patient based on that data. Because somebody can have a pressure of 150 over 90, for example, and that is actually okay for them.
For that patient, absolutely.
And that's where technology and algorithms work very well. But then you need I call it the art of medicine, right? You have the providers that understand what that means for that particular person, because we're all snowflakes. We're all different shapes and sizes. No two snowflakes are the same, and no two body compositions are the same. Anyway, I know that I'm running out of time, but I think you're right. You're absolutely right. I wanted to just add the element of my passion, which is on the other side of that, and House.md provides that. That's that glue, because we do have access to their cardiologists, their endocrinologists, and we're that glue, and we just focus on that. We're there to be that kind of glue between both and provide both care. We're not trying to take patients, steal patients, we're trying to share patients.
Dan, we're going to have to leave it there.
No.
Great conversation. To my audience, if you're not talking to House.md, you need to be hmd.healthcare.
Thanks for your time, and I hope everybody's having healthy and safe out there. Okay, great.
Thanks, Dan. I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.